Bannayan-Riley-Ruvalcaba syndrome. Bannayan-Riley-Ruvalcaba syndrome (BRRS) is a rare overgrowth syndrome and hamartomatous disorder with occurrence of multiple subcutaneous lipomas, macrocephaly means large skull, and hemangiomas. This disease is inherited as an autosomal dominant manner. The disease belongs to the family of hamartomatous polyposis syndromes, which include Peutz-Jeghers syndrome, juvenile polyposis, and Cowden's syndrome. Mutations of P10 gene, remember it is P10 gene, underlies this syndrome, as well as Cowden's syndrome, Proteus-like syndrome. These four syndromes, Cowden syndrome, Proteus-like syndrome, Bannayan-Riley-Ruvalcaba syndrome, are known as P10 hamartoma tumor syndromes. Now coming to the genetics of Bannayan-Riley-Ruvalcaba syndrome is determined in majority of cases via the P10 gene, which represents about 30 mutations in this case. This P10 gene regulates cell growth, and when it doesn't work properly, it leads to the hamartomas. The P10 chromosomal location is 10q23.31, 10q23.31, while the molecular location is 87863438 and 8797930. 8786338 and 8797130. There are many syndromes that are linked to P10s aside from Bannayan-Riley-Ruvalcaba syndrome. The syndrome combines Bannayan-Riley-Ruvalcaba syndrome. This combines Bannayan-Zonana syndrome, Riley-Smith syndrome, and Ruvalcaba-Meyer-Smith syndrome. This Bannayan-Zonana syndrome is named after George A. Bannayan and Jonathan Zonana. Now coming to the signs and symptoms. The signs and symptoms of Bannayan-Riley-Ruvalcaba syndrome, as I have told you, there will be an enlarged head and benign mesodermal hamartomas, multiple hemangiomas, and intestinal polyps. There will be dysmorphy as well as delayed neuropsychomotor development. The head enlargement does not cause widening of ventricles. Or raised intracranial pressure. These individuals are at higher risk of developing tumors, as the gene involved in Bannayan-Riley-Ruvalcaba syndrome is phosphatase and tensine homologue. Some individuals have thyroid issues consisting with there will be a multinodular goiter, thyroid adenoma, differentiated non-medulated thyroid cancer. Most of the lesions in BRRS, that is Bannayan-Riley-Ruvalcaba syndrome, are slowly growing. This you have to remember. Visceral as well as intracranial involvement may occur in some cases and cause bleeding, and as there is increase in size, it will cause symptomatic mechanical compression. Now coming to the diagnosis. How to diagnose Bannayan-Riley-Ruvalcaba syndrome? There is no current method outside the physical characteristic that may present as signs and symptoms. There are, however, multiple molecular genetic tests and cytogenetic tests to determine Bannayan-Riley-Ruvalcaba syndrome. Now coming to the treatment. In terms of management, we should observe for the signs and symptoms that are present and treat those as there is no current guideline. The affected individual should be monitored for cancer of thyroid, breast and renal.